Earlier on, we've had an overview of what drug-drug interaction is. We went ahead to actually talk about useful drug-drug interaction. We also spoke about trivial drug-drug interactions, which I said trivial drug-drug interaction are basically drug-drug interactions that are not of clinical importance. All right. So talking about the harmful drug-drug interaction now, we'll talk about what harmful drug-drug interaction is, and we'll also go to talk about um, some examples of drugs, okay, that are likely to become some drugs that are likely to have a harmful drug-drug interaction, all right? So most of the times when treating diseases with these drugs, um, you always use those drugs only then. Do you understand? Like if you get to actually pair those drugs up with other drugs, it's likely that they will interact and to be harmful. Okay. So harmful drug-drug interaction. All right. So this is common with some drugs with what? A steep dose response curve. Okay. So special care is required with concurrent therapy of such medications. Do you understand? So a harmful drug-drug interaction is basically the type that um, maybe another drug is stopping the effect of another drug, right? Therefore, it is now what? Harmful. Or it could be that another drug is interacting with another drug and stopping its excretion from the body. Do you understand? So therefore, it is causing the accumulation of the other drug. Do you understand? So warfarin and other anticoagulants are likely to uh, have a drug-drug interaction that will be harmful to you because these are anticoagulants. Do you understand? Um, they actually stop blood from clotting. Do you understand? They stop blood from clotting. Like when the blood is flowing in your vessels, it doesn't really need to clot. Do you understand? But sometimes when you combine warfarin with other drugs, then your blood will clot even when you don't really need it. Then anticonvulsants too, then cytotoxic drugs too are likely to actually uh, put up a harmful drug-drug interaction in your body. Drugs for HIV/AIDS too are likely to put up a harmful drug-drug interaction in your body. That's when you actually combine them with other drugs. Do you understand? Then immunosuppressants. These are basically drugs that you take up when uh, you take these drugs when you have, like, let me say, they did organ transplants to you. Do you understand? So you take these drugs so that it will now suppress your immune system, so that your body will be tricked to accept that organ that was transplanted to you. Do you understand? So these drugs are all drugs that have what? A steep dose response curve. They are likely to have harmful drug-drug interaction when you take them in combination with other drugs. Then digoxin. Digoxin is basically a type of drug that other drugs are likely to inhibit its excretion. Do you understand? So digoxin is likely to actually accumulate in your body when you take it with other drugs. Then oral hypoglycemic agents too. Then xanthine alkaloids. Then we have the MAOIs. Those are the monoamine oxidase inhibitors. Do you understand? So these types of drugs are used to actually treat symptoms of depression, like if you are sad, if you have anxiety, if you are worrying about something. Do you understand? So all these drugs, they have a steep dose response curve, and they are likely to actually um like, let me say, like normally when they are prescribing a drug, then they prescribe it together with another drug. So if you take these types of drugs with other drugs, then they are likely to actually um, react, okay, harmfully to you. Okay, guys. So that's it about the types of harmful drug-drug interaction. Basically, the types of drugs that are likely to undergo a harmful drug-drug interaction in your body. Okay. So guys, that's it, and see you guys in the next tutorial. Bye for now.